Well, believe it or not, more than 1 million people in America will have a heart attack this year. It's a pretty scary statistic. Dr. Scott Ackerman is one of the First Coast's leading oncologists. He joins us every Friday to talk about important health issues such as this. He has also brought along with him a special guest, Dr. Ackerman. Thank you, as always, for being here, sir.
Thank you, Casey.
Introduce us to our special guest.
This is a very good friend of mine, Dr. Garas. Dr. Garas is a cardiologist, and he really is my go-to guy when I see patients that have heart problems or cardiovascular issues. I know I can pick up the phone. Dr. Garas is a great resource. He's wonderful with his patients, and I really enjoy working with him.
Well, I talk about that statistic. That is really scary. 1 million Americans will have a heart attack each year. So, Dr. Garas, let's start with you and kind of dive into this and explain exactly what happens during a heart attack.
Scott, thank you very much. First, I appreciate that. Well, heart attack obviously is one of the most common diseases that causes morbidity and mortality in all the industrialized world. A heart attack is a basic problem where the blood and oxygen going to the heart is limited, either by blockage or a clot, something that ruptured that prevents blood flow. And as a result, that part of the heart muscle dies. It's kind of like grass that dies when it doesn't get water. That's really what a heart attack is. The causes, the etiologies vary, but the basic concept is where that blood is not getting to the heart.
And Dr. Ackerman, what are some of the signs, the warning signs, the symptoms that people at home should be on the lookout for? I mean, you can never go over these enough, because if you experience one of these, I'm assuming you should get to the hospital as soon as possible. Well,
the most common symptom that you think of, and we talk about a lot, is chest pain, right? You always hear about people having chest pain. That's a heart attack. But there's other symptoms as well that might make you, that should make you aware that you may be having a heart attack. Frequently, it can be discomfort in the upper part of your chest, typically the neck or the arm, some shortness of breath. If you get cold sweats and nausea, some lightheadedness, these all could be signs of a heart attack or an impending heart attack. And what's interesting is we've looked at women and heart attacks. And a lot of the research, a lot of the studies have always been focusing on men with heart attacks, but women are just as likely to get heart attacks, and heart disease is the #1 killer in women also. So well, we've been looking at women and their symptoms, and it turns out with women the symptoms could be a little bit different than what a man would have. Sometimes, and you always hear about pain in the left arm. In women, the pain sometimes goes up the neck instead. So the symptoms aren't that specific in women as there are in men. And women need to be aware of these symptoms as well, because if you have any of these symptoms, if you're having a heart attack, you can be treated. You need to be treated quickly, and you can recover from it if you're treated quickly. So you need to call 911 immediately if you have these symptoms and are thinking of a heart attack.
Yeah, I'm sure it's better to be safe than sorry, especially when you look at some of the things on your screen. If you're suffering from any of those, get to the hospital ASAP. And Dr. Garas, let's go back to you. We're talking about the importance of getting treated as quickly as possible. Are there any new advancements in treatments for heart attacks?
Well, absolutely. The good news is the death and the morbidity from heart attacks over the past decade, according to most recent AHA, American Heart Association numbers, have decreased. So it's one of the few diseases that we're really helping patients immensely. There are new medications that we use, the more aggressive blood thinners that open up the artery very quickly. We have better equipment to suck out clot. We have new stents that are medicated, and even more importantly, newer stents that we're trying out now that are absorbable. They go in the body and disappear after a few months. So all these new advances put together, in addition to, most importantly, the urgency that we have and the protocols that are set up across the country to quickly treat patients with a heart attack, have really contributed immensely to the reduction of death and long-term morbidity from that problem.
And let's talk about, Dr. Ackerman, what is the best thing that you can do to try to prevent this in the first place? Are there certain things that you can do with your diet and lifestyle?
Right, just like when we talk about with cancer, with heart disease, the prevention is a big part of preventing heart disease. Now, there are certain things you can't control, and that's your genetics. And some people are just genetically predisposed to getting cardiovascular disease, no matter what they do. But there are things you could change in your life that can help prevent coronary artery disease. Smoking is a contributor, just like it is for lung cancer. It contributes to atherosclerosis. So you want to not smoke, especially if you have a family history of heart disease. All the more reason not to smoke. All the more reason to look at your blood pressure and your cholesterol. These three things, cholesterol, blood pressure, and smoking, are very strongly related to coronary artery disease. Also, maintain a healthy weight. You want to have a good body mass index. Eat right. Be physically active. Those sort of things.
Yeah, you always hear that, you know, eat healthy, live healthy, exercise, but I mean, as you can prevent so many things just by those simple steps in your daily lifestyle. Thank you so much, Dr. Ackerman, as always. We appreciate you, Dr. Garas.
Thank you.
Thank you so much for joining us. We appreciate it. And thanks so much again to Dr. Ackerman for coming on every Friday, providing us with such valuable information and for sponsoring this segment. And if you have any questions regarding this topic or any other health questions that you might have, you can visit Dr. Ackerman's Facebook page, which is simply facebook.com/First Coast Oncology.